Hello there. Why are the mucous membranes of my cat pale or anemic? This is video 2 in a 3-video series that discusses classification of anemia and different types of anemia. In this video, I'm going to discuss acute blood loss anemia, sub-acute blood loss anemia, and chronic anemia. So let's start with acute blood loss anemia. Most cats involved in an car accident or mauled by a vicious dog are already in shock by the time they arrive in the hospital. So what is shock? Shock is a state where a cat's body is experiencing insufficient flow of blood and oxygen towards its all tissues and organs. The common cause of shock in cats is sudden blood loss or hypovolemia triggered by a car accident or severe dog bite. Other causes of shock are defects in the heart itself or in the distribution of blood through the intravascular system. What are the clinical signs of a cat in shock? Always be aware, the prevailing clinical signs will always mirror the volume of blood the cat has lost. Visible bleeding wounds, right? You might see where the bleeding is coming from. There's broken skin and the blood coming out. Internal bleeding, which may have to be diagnosed by your veterinarian. The cat has pale, dry, and anemic mucous membranes. The toes, the legs, the front legs, the back legs, all the toes are very cold. The temperature is low. The cat might be disoriented. There is increased heart rate and breathing. The cat may be unconscious. If a cat loses between 30 and 40% of its blood volume, chances of survival are very slim. Your veterinarian will assess the level of shock and other injuries to determine the right treatment for your cat. Now let's look at subacute blood loss anemia. In this group of subacute blood loss anemia are parasites that directly attack and destroy or hemorrhage red blood cells, causing hemolytic anemia. Examples are mycoplasma hemofelis, cytauxzoon felis, and babesia felis. Those parasites normally attach themselves to the red blood cell and break it down, causes hemolysis. The clinical signs associated with hemolytic anemia are anemic or jaundiced mucous membranes, lethargy, weakness, anorexia, and fever. Immune-mediated hemolytic anemia, or IMHA, is a condition where the immune system stops recognizing the red blood cells as its own and forms antibodies to hemorrhage them. The clinical picture is very similar to that of the blood parasites. All the above hemolytic conditions are treatable, and your veterinarian will use appropriate diagnostics to differentiate and treat the one involved. As stated before, hemolytic anemias are regenerative, and the bone marrow will be able to replenish the lost red blood cells. Now let's look at chronic blood loss anemia. Any parasite, external or internal, that sucks blood from the cat will cause chronic loss anemia. Fleas, lice, ticks, and hookworms are examples of parasites that cause chronic blood loss anemia. Other causes of chronic blood loss anemia in cats are gastric ulcers and breeding tumors. Chronic blood loss anemia is non-regenerative. That is, the bone marrow does not respond to the loss of blood. That's the end of the video. Right? Now you'll be able to differentiate between acute, subacute, and chronic blood loss anemias. If this video was helpful, subscribe, share it, or comment or ask a question below. Thank you for watching.